everybody, it's Ethan again. I specialize in all things when it comes to the senior healthcare side of retirement. And I want to talk about a very important subject that I get questions quite often, especially with Social Security full retirement age being above 65 now, is what if you're working past 65? Or what if your spouse, you're getting coverage to your spouse and you're going to be over 65? And what are some things to consider? Well, first off, by you turning 65, you're always eligible to enroll in Medicare. But there's some factors on whether or not you should delay it. And then the other question is, well, if I'm delaying it, how do I avoid this penalty I keep hearing about? So let's first break down that first part, is your group coverage. What type of group coverage is it? The factors you need to consider is how many employees there are at your place of employment. If there's less than 20 employees and you want to stay in your group coverage, what will end up happening is Medicare has to pay first and then your group coverage. Therefore, you would have to enroll in Parts A and B of Medicare, and then your group coverage would pay secondary. But if there's over 20 employees, which is the majority of the cases of ones working nowadays, then ultimately it means it's credible coverage, which means it's as good or better than Medicare. And since there's over 20 employees, your group coverage will pay first, and if you decided to enroll in Medicare, then Medicare would pay secondary. So if there's over 20 employees, it's credible coverage, and you decide to then stay with your group coverage and delay Medicare, then the other question I get is, well, my friend told me that if I don't enroll in Medicare, I'm going to get a penalty. I have to enroll in Medicare. There's different factors to consider. Technically, as long as there's over 20 employees, you do not have to enroll in any part of Medicare, and you won't be penalized later on as long as you still keep with that group coverage that's over 20 employees. Now, what ones will misinterpret a lot of times is, since you've paid at least into Medicare taxes for at least 10 years, your Medicare Part A won't have a monthly premium attached to it, whether you or your spouse paid into those taxes for 10 years. Therefore, ones working past 65, staying there in the group coverage, will typically enroll in Medicare Part A, since it doesn't cost anything, pays secondary, so essentially you get a little bit of extra protection with no additional cost. There's different things to consider when it comes to having an HSA, contributing to an HSA, which we'll talk about later on. That is a health savings account. We'll talk about that in another video. There's some other factors to consider. What ends up happening is then once you decide to retire, whether it's 2 years, 5 years, 1 year, whatever it may be, once you are losing that group coverage, you then get a special enrollment period. What you do is you call up Social Security, go into the office, go online, print off the forms for the Part B application, as well as the Part B special enrollment application. And there's two forms. The first form you fill out enrolling in Part B of Medicare. The second part is there's a portion you fill out as well as then a portion you give to your employer. It's an employee verification to show that you've had credible coverage, allowing you to enroll in this special enrollment period and allow you not to be penalized for delaying enrolling in Medicare, working past 65. Those are just a few things. That's the most generic scenario, most common scenario I get. There are different factors to consider based on your situation. Again, if you're contributing to a health savings account, it may affect your situation and time periods to enroll. But I hope this was able to help you better understand delaying Part B in Medicare and not being penalized.